tell us, first of all, sort of the average age of a patient that you've seen in your studies? I know it varies greatly, but maybe give us a couple patient stories. You've dealt from high performance professional athletes to, normal everyday parents or housewife or husband that is wants to stay active.
Well, the average age is somewhere around 40 years of age. We do them in patients as old as 60, even into the mid-60s. The FDA criterion, of course, was 60, but there's many patients that are physiologically young. And for example, an older patient that before we would consider to do a fusion on, now we do artificial disc. And one patient that comes to mind was a patient who had come to me for his lumbar spine, and I examined him and his reflexes said there may be something going on in his neck. So we did an MRI scan of his neck, and he had a massive herniation at the C5-6 level and a smaller one at C6-7. At the C5-6 level, he had tremendous cord compression. So I thought, oh, at his age, and he was in his early 60s, I thought, he's probably going to have bone spurs. So we got a CT scan, and lo and behold, it was all soft tissue. So traditionally in the past, I would have done a 2-level fusion on him. We did a 2-level cervical disc replacement. He came back, he's doing fine. The funny sensation he had of his hands and a little bit of dexterity, and even some of the leg symptoms he's having was actually coming from a cervical spine. So that's somebody that in the past we would have done a 2-level fusion, every day, day in and day out. Now that we have artificial disc, it's a much better option for him because he also had some degenerative changes above and below.